Hi, I'm Mandy. I'm Dr. Farahani's hygienist here at the office. Today with this video, what I'm going to go over with you are the fundamental basics of our home care regimen that we recommend for our patients to help assist us in treating and preventing gum disease. So gum disease has been linked to causing a lot of complications. There's a systemic link, so it's been linked to causing cardiovascular disease, strokes, respiratory problems, and even causes some complications in people who are diabetic. So we do have a natural gum care program that we provide here at the office. So what we do is we take a sample of your bacteria and look at it underneath the microscope. So that'll help us determine if you have healthy bacteria or if you have some degree of gum disease. So we end up recommending specific home care for those individuals who have gum disease. So as well as provide a strict hygiene regimen that's going to help us treat and hopefully cure your gum disease as well. So what we're going to do is go over the basics today for the home care. So what we want to start off with is the sequence. So we want to floss first, brush, and then use a WaterPik. So the reason why we want to floss first is to help remove the bigger pieces of food and plaque in between the teeth, and then we'll end up brushing with our natural toothpaste after. So with flossing, what you want to do is between each section, you want to move to a new piece of floss. So you would be doing in between one of your teeth and then moving to the next section to be able to go along. So each area you're going to switch to a new section. We do have a special toothbrush that we recommend. It's called a 2-row toothbrush. So that's going to help get along the gums without having us be too aggressive along the gum line. So here I have a 2-row toothbrush, so we're missing all the rows on the inside. So I'm just going to show you with our model here how to properly use this. So for the back teeth, because the back teeth are really bulky, what we would want to do is put one row on the chewing surface and then tip the other row so it goes along the gums. So what we would do is just jiggle back and forth, lightly jiggle, and then sweep it away and move to the next section and slowly moving forward. For the teeth in the front, because they are narrow, what you would do is straddle the teeth and again tipping it forward so you get the row right along the gums, and you would jiggle back and forth and sweep. And same along the inside, you'd straddle, tip it inwards, and jiggle and sweep. So you'd be really going by feel. It takes a little while to get used to. Some people who feel like the 2-row toothbrush doesn't make them have a clean feeling, there is a electric toothbrush that we recommend. It's called a Philips Sonicare. The only one that we really recommend is just getting the basic model. You don't need to get the one with all the bells and whistles. So this electric toothbrush is safe to use along the gums. What's really nice about this toothbrush as well is they have different size toothbrush heads. So they have a toothbrush head that's made for an adult that's bigger, and they even have ones that are smaller for a child. So all you would need to do is get one unit, one toothbrush, and then you can buy the individual heads. Another thing that's really nice about these electric toothbrushes for the family is you can get a colorful ring that comes with the toothbrush, and then each person in your family can have an assigned color. So what's important about the toothbrushes, whether it's the electric or whether it's the manual, is disinfecting. What we don't want to do is reinfect our mouths with the bacteria that's accumulated on the toothbrush. So very important that with the toothbrush heads that we soak them in some hydrogen peroxide for at least 3 to 4 hours, or even overnight. And then when the time is up, what you would do is just rinse it under some warm water, and then you'd be good to use it again. And then you would only have to do that once a week. As you're trying to make all these really great improvements for your oral health, we don't want to be putting any bad bacteria back into the mouth. Our third recommendation is a WaterPik. So what happens is, even after flossing, even after brushing, we can get food and plaque that's still left on our teeth. And so what we would recommend is doing the WaterPik. At the same time as using the WaterPik, not only are you just going to be using water, you would be adding a natural medicine to the gums to help treat the gum disease, help us treat the gum disease. And then if you do have healthy bacteria, you would put something a little bit more mild in your WaterPik. So you would use something like rosemary oil, and then that'll help. Not only would you be flushing the food and plaque, but you have the rosemary oil as a nice antibacterial. What happens to another thing that we recommend is a tongue cleaner. So for the tongue cleaner, we recommend to do this once a week. The tongue has a lot of grooves and crevices in it, just like a WaterPik, or just like a carpet. So with the tongue, what we want to do is clean the tongue with a tongue cleaner opposed to using a toothbrush. A toothbrush sweeps the surface plaque around but doesn't end up removing the plaque for us. So there's different models that you can get of tongue cleaners. So we have one that's bendable, and then we have ones that have handles. So there's no right or wrong way to do it. You just scrape the top of your tongue. And then again, that's only once a week. So with all of the basic home care that we recommend, this is it. For everybody, there is a tweaking option as we find out what kind of bacteria you have. It's all going to be adjusted on an individual basis. And that's the same with our natural hygiene, or our natural gum care program, where we see you for natural cleanings. That always is adjusted as we examine the bacteria. So hopefully this is everything that will get you started on the way to wellness. If you ever have any questions, you can always email me at Mandi, M-A-N-D-I, @alifarahani.dds.ca. Thank you.